So first thing I would do is I would check my patient's chart, make sure there is an order for NG insertion. I would go ahead and gather all my supplies, perform hand hygiene, and verify my patient. I would then go ahead and hire my patient to a 45-degree angle, and then also lift up the bed to elbow height, which it already is.
Hi guys, bye-bye. Have a good one.
Okay, I would then go ahead and drape pad over my patient's chest. Then go ahead and open my NG tube. Put on gloves. So I would then go ahead and measure my NG tube from the nose to the bottom of the earlobe and then down to the xiphoid process. I would add on any extra length per manufacturer's orders or facility's policy. And then I would then tape that off and mark it. I would then go ahead and apply lubricant about 2 to 4 inches of the tube. And then I would go ahead and start to insert. I would lift my patient's chin, have their head laid back on the pillow. I would insert upward and backward. Okay, once the pharynx is reached, then you want to go ahead and let your patient touch their chin back to their chest. If any gagging or coughing are present, you want to go ahead and check the placement of the tube with a tongue blade and your pen light to go ahead and check if placement is correct. You want to go ahead and then give your patient water. As they're drinking the water, once you're advancing, once they take a breath, you are going to go ahead and stop and make sure you have inserted all the way to where you marked it off at. Then you want to go ahead and secure it loosely to the nose, very loosely to the nose or the cheek. I'm just going to do it here to the nose. To the cheek, I'll do it to the cheek. And then you want to go ahead and verify that the placement is correct using at least 2 methods. You would go ahead and get an x-ray. Once that x-ray is done, you are gonna grab a syringe and you're gonna aspirate at least 30 mLs of contents. Having a basin nearby, you're gonna go ahead and empty those contents into the basin. With your pH test strip, you're gonna go ahead and put that in the contents, wait about 30 seconds, and then compare the color to the manufacturer's paper. You then wanna go ahead and actually visualize the contents, checking for color and consistency. And then you want to go ahead and measure the length from the exposed tubing to the nose, and then go ahead and chart that. After confirmation of placement, you want to go ahead and cut a piece of tape as so, about 4 inches, splitting it but not completely. This is after confirmation of the placement. You're going to go ahead and tape it to or first you would apply ointment and wait for it to dry. Then you would go ahead and apply your tape, wrapping the tape around the NG tube loosely without pulling too much on it. Okay. Then you're gonna go ahead and remove the syringe here. And then you are gonna go ahead and connect it to go ahead and cap it back up. Then you're gonna go ahead and connect it to the patient's gown. You can put a piece of tape here, grab the gown, and then with the safety pin, secure it here. Okay. And then at this point, I would connect the tubing to suction. I would turn on the suction and connect here. And then you would measure the length of the exposed tube with the ruler, as we said. Then you would do oral hygiene every 2 to 4 hours and lubricate the lips. You would remove everything, take off your gloves and additional PPE. You would go ahead and I'm gonna take off my gloves and remove any PPE, and then also removing the pad here. Okay. Then you would also lower the bed, make sure the patient is comfortable, put them back in a comfortable position. I'm just gonna roll into my next video, which is the bolus feeding. You would check the patient's chart and make sure there is an order for the bolus feeding, and grab all the supplies necessary. You would go ahead and perform hand hygiene, verify the patient, let them know what you're doing and why you are doing it. Go ahead and close the door. You would then start the bolus, close the curtain. You would then perform the bolus feeding, 30 to 60 milliliters, and the frequency you would just check the physician's orders as far as the bolus feeding goes. Once you're done with that, you would lower the patient's bed, put them back in a comfortable position, and make sure you answer any questions or concerns. Also performing hand hygiene and removing any gloves or PPE that was present. Then to remove the NG tube, you would go ahead and of course check the patient's chart, make sure there is an order. You would then perform hand hygiene once again. Also verifying your patient, letting them know that you will be removing their NG tube, that there may be times of discomfort. You would then drape your patient, close the door or close the curtain. You would start off by getting some gloves. You would then get a syringe of 10 milliliters of saline solution or water. And you, while you have that, you're gonna remove the tubing from suction. So you would turn off the suction and then remove it. I would double to clamp it. Right there. That there. Grab your syringe with the 10 milliliters of solution. We'll open this up. And then of course making sure your patient is at elbow height at a 45-degree angle. You would go ahead and give tissues and emesis basin. You are gonna also drape the patient here once again. And also remove the tubing from the gauntlet. We're gonna go ahead and flush the tubing with the 10 mils of solution. And then you are going to clamp it by folding it, doubling the tube on itself. You are then going to instruct your patient to take a deep breath and hold it. You do want to remove the tape here. Okay. And then again, double clamp it. You're gonna go ahead and tell your patient to take a deep breath and hold it, and you quickly remove the NG tube while wrapping it in the padding and disposing of that. You're going to remove your gloves, perform hand hygiene, dispose of the tube. You want to offer oral care every 2 to 4 hours, and then also you want to check the contents of the in the suction kit of the NG tube, document that, and then remove any extra PPE. And that's it.